Hi, this is Lindsay. Welcome back to myMPN. I am going to quickly go through the introductory survey, which is intended to gather some demographic information about participants as well as some historical information about their treatment. There's usually messages that start things off, reminding patients that they can always go and change their privacy settings at any time. I'm going to quickly go through these questions. You'll see there's also sometimes some gamification that allows the participant to understand how their responses compare to others in the system. And as I said, I'm going to skip through some of the questions just for efficiency's sake so we can get through this entire profile. As you can see, the nature of these questions right now is strictly demographic. As I said, the questions in that section are primarily demographic information, collecting education, job information, etc. We're going to move into another section of the survey, the introductory survey, which focuses on the individual patient's disease history. Obviously, we're going to be just making some answers up here, but obviously, we're hoping that patients will be able to answer as many questions as they can. And we always do give them an opportunity to skip the question if they feel they need to. And many of the questions have what we call branching logic. So if participants answer in a certain way, such as I just did, where I said yes to the question of genetic testing, that brings up another screen which will ask for what were the results of that testing. We call that branching logic. We also sometimes will ask questions that we anticipate will be followed up with additional surveys. So for example, this one is about family history. And if an individual responds to this question in a certain way, then we will be pushing out another survey to them at some point about that family history. Here we have several questions relating to the treatment of the patient. And I'm going to pause again just to get through a series of questions here for time. So we answered a few questions about stem cell transplant and spleen removal. This is a question about treatments that I stopped taking. I'm going to answer affirmatively to a JAK inhibitor because that brings up additional questions. So just to show this again, the branching logic. And it also asks why the drug was stopped. We have several questions about other comorbidities and issues that have come up related to the NPN. These are a few examples of that. And finally, we have some questions about clinical trials. If an individual says that they are participating in a clinical trial, we gather information on which one. And that is the end of the introductory survey, which brings us back to the dashboard. Now on the dashboard, an individual will have an opportunity to fill out the health activity form, which is focused on events that the patients may have experienced in the recent past. It could be a thrombotic event, a transfusion, could be a change in their medicine, a hospital stay, a bone marrow biopsy, any number of things. And they can select more than one, or they can just select one. I'm going to select blood draw just for this particular example because you'll see that it brings up another survey onto the individual's dashboard.